The liver is the largest organ in the human body. It keeps us alive by performing hundreds of vital body functions. And it's the only organ in our body that can repair and regenerate itself. Sometimes the liver can become severely damaged due to diseases, infections, or genetic disorders. Over time, this damage can lead to liver failure and life-threatening complications. Because the liver carries out highly complex functions that no machine can replicate or sustain, transplantation becomes the only definitive life-saving option for patients with advanced liver diseases. Liver transplant is a life-saving surgery where a failing liver is replaced either with a healthy liver or a portion of it. Transplants are broadly classified into two groups: diseased donor liver transplant and living donor liver transplant. In a diseased donor liver transplant, the liver is retrieved from a dead or brain-dead individual, whereas in a living donor liver transplant, a healthy individual donates a portion of their liver to save someone else. More than 80% of liver transplants in India are living donor transplants. Liver transplant is considered to be one of the most complex and high-risk procedures in modern medicine. The need to safeguard the life and health of the donor makes living donor liver transplants more challenging than diseased donor liver transplants, where care is focused primarily on the recipient. A donor operation can take 5 to 6 hours, and the recipient surgery can last 12 hours or more. In living donor transplants, both surgeries take place simultaneously, necessitating advanced infrastructure, multiple transplant teams, clinical excellence, flawless coordination, and time-tested protocols. The Department of Liver Transplant and Hepatobiliary Surgery at Amrita Hospital, Faridabad, provides comprehensive care for all liver, pancreas, gallbladder, and bile duct conditions with unmatched clinical excellence and compassionate care. Spread across a magnificent 130 acres, Amrita Hospital in Faridabad stands as one of India's largest and most advanced healthcare campuses with a capacity of over 2,600 beds. This world-class facility features state-of-the-art transplant operating theaters, a dedicated transplant ICU with 18 specialized cubicles, and cutting-edge diagnostic and therapeutic technologies specifically designed to support the most complex organ transplant procedures. This ecosystem of medical excellence is home to some of India's finest hepato-pancreato-biliary surgeons with decades of extensive experience in performing highly complex HPB surgeries. Backed by a multidisciplinary transplant team and time-tested protocols refined over decades of clinical excellence at our flagship Amrita Hospital, Kochi, we deliver outcomes comparable to those of the world's leading liver transplant centers.
In the Department of Hepatopancreaticobiliary Surgery and Solid Organ Transplant at Amrita Hospital, Faridabad, we provide comprehensive care for all kinds of diseases of liver, pancreas, gallbladder, and the bile ducts.
We perform liver transplantation in chronic liver disease, acute liver failure, acute or chronic liver failure, pediatric patient, and other high-risk transplant.
Since its inception in 1998, Amrita Hospital, Kochi has been transforming lives by doing the impossible through early adoption of emerging technologies, innovative approaches, and most importantly, a passion to serve. Our liver transplant program was established in 2004. We are home to India's first and largest robotic donor hepatectomy program and India's first and largest robotic recipient liver transplant program. Through continuous innovation and refinement, Amrita Hospital, Kochi has evolved into one of India's foremost centers of excellence for both adult and pediatric liver transplantation. In 2018, we introduced fully robotic donor liver hepatectomy in India. In this approach, the donor liver is carefully separated through small incisions using high-precision robotic systems. The graft is then retrieved through an incision in the lower abdomen well below the belly button. This advanced technique results in less pain for the donor, faster recovery, and minimal visible scarring. Today, Amrita Hospital, Kochi, has emerged as the national leader in robotic liver transplantation and is recognized globally as the second largest center for robotic donor hepatectomy.
So one of the problems with most surgeries is that we have to go through normal tissues, during which process there is significant damage to many normal tissues that we require. This is almost like to kill a terrorist, we have to kill many civilians. So one of the major big breakthroughs came when we had keyhole surgery or minimally invasive surgery, where the damage to the normal tissues was very minimal and we could focus directly on the area of interest and just attack that area alone and leave the normal tissues. So although this was there in most surgeries, it came very late in the liver transplant scenario. And Amrita Hospital was one of the first to perform this. In fact, in India, we did the first robotic donor surgery where through keyholes, we did the complete procedure of dividing the liver. And we took out the liver through a small cosmetic incision, therefore decreasing the damage to the donor as much as possible. We have now completed more than 500 such operations for the donor, and we are probably the largest in the country. Now this same surgery we are now giving to the recipient as well, whereby instead of having large incisions in the abdomen to remove the liver and put the new liver in, we can do the whole procedure of detaching the liver from the body and attaching the new liver using precise robotic surgery. All we need is a 10 or 11 centimeter nick in the abdomen to remove the liver and insert the new liver. So this has brought about, again, significant advantages to the recipient as well, whereby the recovery becomes much more faster because damage to the muscles is much less than what we would normally have when you do a conventional open surgery.
Every liver transplant journey begins with a thorough, compassionate pre-transplant assessment for both the donor and the recipient. Our dedicated multidisciplinary team, including hepatologists, transplant surgeons, intensive care specialists, anesthesiologists, transplant coordinators, pharmacists, infectious diseases experts, dieticians, rehabilitation specialists, and transplant psychologists, comes together to carefully evaluate each case and design the safest, most personalized transplant strategy. Both donor and recipient undergo comprehensive assessments of their physical health and mental well-being, with a full range of tests and procedures to confirm compatibility and minimize every possible risk. At Amrita Hospital, Faridabad, our specialized de-addiction support services help recipients overcome alcohol dependence, empowering them to embrace their new life with renewed hope, strength, and commitment.
So in the OPD, the patients undergo a detailed evaluation that includes blood work, imaging such as CT scans and MRI, as well as we do the donor workup along with that, because the donors need to be thoroughly evaluated for donor safety and the feasibility of their donation. So donors also undergo investigations such as blood investigations, CT scan, MRI, cardiac ecography, and for ladies that includes gynecological investigations as well.
The liver's unique structure and remarkable regenerative capacity make living donor transplantation both possible and safe. The liver has two main lobes, the larger right lobe and the smaller left lobe, each with its own blood vessels and bile ducts. This specialized anatomy allows surgeons to carefully separate a portion of the liver for transplantation. Thanks to the liver's extraordinary capacity to regenerate, both the remaining liver in the donor and the transplanted portion in the recipient grow back to near full size and function, usually within 6 to 8 weeks. In a living donor liver transplant, the donor and recipient surgeries are performed simultaneously by two specialized surgical teams working in perfect coordination. While one team carefully removes the diseased liver from the recipient, the other dedicated team precisely removes a portion of the donor's healthy liver, usually the larger right lobe, carefully selected based on the recipient's body size to provide the ideal graft volume. Once the donor liver graft is safely prepared, flushed and ready, it is immediately transferred and implanted into the recipient. The surgical team then meticulously reconnects the blood vessels and bile ducts, restoring vital blood flow and allowing the new liver to begin functioning right away.
Most of the donor surgeries are being done through the minimally invasive route, which includes both the laparoscopic approach as well as the robotic approach. And for that, we have the latest generation Da Vinci robot available with us.
Our robotic surgery program also take this precision even further. Now, with robotic surgery, we can have this three-dimensional visualization, much more dexterity, leading to performing this complex HPB surgeries with unmatched accuracy.
After surgery, patients are transferred to the intensive care unit, where close monitoring begins immediately. The first week after a liver transplant is the most critical phase of recovery, requiring constant vigilance and expert care. During this period, the body is carefully monitored for early signs of complications such as infections, liver blood flow issues, bile leakage or rejection, enabling timely and effective intervention. The dedicated transplant ICU at Amrita Hospital, Faridabad, is a state-of-the-art facility with 18 specialized cubicles equipped with advanced technologies, including ventilators, dialysis support, and continuous bedside monitoring systems. Care is led by experienced intensivists and specially trained transplant nurses, supported by round-the-clock access to advanced diagnostics and treatment facilities. With continuous monitoring and rapid response to even the smallest changes, our ICU team plays a vital role in ensuring a safe, stable, and uneventful recovery during the most vulnerable phase of the transplant journey.
Our ICU team focuses on the immediate and meticulous care of patients after liver transplantation. These patients arrive in a very critical phase where monitoring of every parameter matters. Our ICU team seamlessly monitors the liver function, optimizes medication, prevents infection, and ensures smooth recovery of organs which were impacted by liver failure. Post-transplant recovery is not about managing symptoms, it's about restoring lives.
In the first 3 months after surgery, close monitoring remains essential. It is always best to stay near the transplant center during this time to ensure easy access to care. Lifelong immunosuppressant medication is required to prevent rejection. The good news is that today's advanced organic-specific therapies help minimize the risk of excessive immune suppression and frequent infections. Over time, most people gradually return to their normal routines, including travel, exercise, work, and social activities, often within 6 months. With structured follow-ups, regular exercise, healthy lifestyle changes, a balanced diet, and complete abstinence from alcohol, recipients can enjoy a full, healthy, and active life for many years. At Amrita Hospital, Faridabad, our dedicated liver transplant follow-up clinics provide advanced, focused, and seamless care, supporting your long-term success and addressing all your concerns. At Amrita, we do more than perform surgeries. We help individuals and families restore lives through some of the most advanced, precise, and safest liver transplant and HPB surgeries. Rooted in a legacy of clinical excellence and compassionate healing that has transformed countless lives, Amrita Hospital, Faridabad makes advanced HPB surgery and liver transplantation accessible to all.